Senator Carter, welcome always, and
Thank you, sir.
I know you have some good work to report to us, and we welcome you to Senate Health and Welfare, and we have Senate Bill 556 for our consideration.
Mr.
And
Chairman
welcome everybody to the
and
table.
members, thank you very much. Before I begin, I'm going to have the table introduce themselves, but I'm going to begin as a very proud uncle, introduce my niece who's here, who is the impetus for me bringing this bill. It's because of her leadership and courage that I'm here today, and with great pride as an uncle, I'd like to introduce my niece, who's a nurse practitioner at Ochsner, Chantel Carter Frank, who
Welcome.
Thank you. Hi.
is, and I should say, is my older brother's Gary's daughter, and the sister of Representative Gary Carter, my nephew. So.
Well,
Very nice to meet you all. I know, right? Surrounded by politics.
So if you would, just real quickly, I'll have everyone introduce themselves just for the record, and then I'll begin, and then they'll have some brief testimony, Mr. Chairman.
make yourself at home. Please, everybody introduce yourself, and we welcome you.
Hi, my name is Jennifer Williams, and I am a registered nurse in the New Orleans area.
Thank you.
I'm Ravi Tandon. I'm a plastic and reconstructive surgeon in New Orleans.
And we all know Representative Stokes. Thank you for being here. Senator, it's all yours, Senator.
Mr. Chairman and members, thank you very much for the opportunity to be here. Senate Bill 556 provides relative information access to breast reconstructive surgery. Patients facing mastectomies, lymph node dissection, lumpectomy are overwhelmed with fear and emotion. According to the American Cancer Society, it is estimated that among U.S. women and men, there will be some 268,000 new cases of invasive breast cancer and 41,000 breast cancer deaths in 2018. Federal law has required health plans to offer breast cancer coverage to provide coverage for breast reconstruction and prosthesis since the passage of the Women's Health Cancer Right Act in 1998. However, a large gap remains between the number of women who require mastectomies and those who are offered breast reconstruction surgery. The American Society of Plastic Surgeons studies have shown that 7 in 10 women are not fully informed about their breast reconstruction options prior to undergoing mastectomy. Senate Bill 556 will help empower women to make the best care choices for their unique circumstances by ensuring that they are properly educated on all available care options. Furthermore, Senate Bill 556 will increase awareness among patients about the availability of breast reconstruction and prosthesis provided under the Women's Health and Care Rights Act of 1998. Senators, this bill has humongous significance. With the dreaded disease of breast cancer and the impacts that it has on patients and families, this piece of legislation will afford the opportunity for many people who find themselves in this difficult situation to understand and be aware of the myriad of options that are available to them. In New York City, this bill was passed, and it had an incredible impact, in New York, rather. It had an incredible impact where people were once again given more information, more resources to make themselves whole again, to have the opportunity to go that next step and take advantage of resources that are there. Again, I cannot tell you how proud I am of my niece. She's going to share with you commentary, but she is an incredible young lady, someone that my family is deeply, deeply proud of for her courage, her strength, and her ability to articulate an issue that's so near and dear to so many people.
You have a wonderful smile. You really
you.
do. Senator, just one thing on the bill itself, I'm in total support, and I just want to make sure we're getting everything. It's in the first line on line 7, it says every general hospital. Is there a definition on general hospital? Would that basically pick up everybody, even private hospitals that are doing these surgeries?
The intent certainly is to be every hospital. So
Okay.
if we need to clarify that,
I was thinking of every hospital licensed under whatever, if it needed to.
for clarity purposes, I would certainly be open to amending it to make sure that we.
We'll work on that as we hear in testimony. I just didn't want a private hospital that met the same criteria to not do the notification.
Very good catch, sir.
Okay,
Thank
very
you.
good.
Hello, everyone. I want to thank you for this opportunity today to come with my uncle, who I am also extremely proud of, and it's because of him that I have this voice and that I am sitting here today. So everyone does know cancer. Everyone knows someone who has cancer, and we all know that we do not want cancer. My story is very similar to many women, many people. My mother died from cancer. She was a fighter, and I am a fighter. My medical knowledge as a nurse practitioner has positioned me to understand the role of the provider, and because of my family history, the role of the patient. Most people who know cancer are afraid of cancer. And remember, we all know cancer. But I am a fighter. Through genetic testing, I was told I had a mutation and I would likely die from breast or ovarian cancer by the age of 50. I decided to change those odds, and I had a prophylactic hysterectomy and a prophylactic bilateral mastectomy with reconstruction in December of 2017. Now, when the methods of these procedures were told to me, I was not given a choice. I was told what was going to be done to me. I knew what had to be done to save my life. But despite the fact that I did not have cancer and I was going to them to prevent cancer, I was still given the same operative procedures as a woman who had cancer, invasive techniques they offered to me. But I knew there was another way to do this, a way that would improve my self-esteem, improve my self-perception, and maintain my femininity, and of course, to stop the cancer. My surgical awareness is a rarity. As a nurse practitioner, I have practiced pediatric surgery at Children's Hospital. I was first assistant to Dr. Charles Hill, Dr. Rodney Steiner, and Dr. Evans Valerie. So when I told my surgical oncologist, Dr. John Colfrey, and my reconstructive surgeon, Dr. Ravi Tandon, no to their way, they thought about it, they listened, but they agreed that it was unnecessary to do it the way that they had suggested. And together, we all came to the best way to reconstruct my body, and we did it with grace and with minimal scarring. Because of my experience, I have come to the awareness that not all women in our country are given the knowledge about reconstructive surgery. Despite federal law, most women are not offered alternative measures. They are not educated about the surgery that is about to take place, and they are not even involved in the choice of what type of technique or surgery is to be performed to save their life. Instead, most women are frightened, they are told what is going to happen to them, and they are told that they should be happy for whatever outcome they get because they are alive. This bill addresses all of those concerns. Some of the medical procedures and processes that are done are dated, and they have already been revised. There are robotic surgeries taking place to laser surgeries being taken place, and they're not offered to our women. To ensure the growth of our nation, we must assure the lives of our women. This bill brings everyone to the table: the oncologist, the reconstructive surgeon, the radiation oncologist, and the patient. And the decisions are made together. The surgery I was offered, I did not choose, but the surgery I chose allowed me to fight cancer and to achieve my desired outcome, which has allowed me to continue to be a mother, a wife, and a working woman. And another thing this bill ensures is that not just women like me with all of this strong family history in politics and in education get the same treatment and the same knowledge about their surgery, but all women have access to this information. Thank you.
I think we need to give you a big round of applause. You know, I always said that, and we'd all say that Senator Carter is one of the most eloquent speakers over here. I think you got him beat. You really do. You really do. I think you got him beat. Thank you so much. Whoever would like to speak next, the floor is yours.
Thank you, Senator Carter, for the warm welcome, and to the Senate Committee. Thank you for your time and allowing us to speak regarding this matter that is very dear to all of us. My name is Ravi Tandon. I'm a board-certified plastic and reconstructive surgeon in the New Orleans area. I received my medical degree from Vanderbilt University, then completed 5 years of general surgery residency at Tulane in New Orleans. I then went to New York City for my plastic surgery training at Albert Einstein, and then did an additional year of fellowship in microsurgery, focusing specifically on breast cancer reconstruction. I married a Louisiana girl, and I came back home.
Thank you for doing that.
So breast cancer will affect more than 260,000 new people in the United States this year. As Dr. Carter had mentioned, since the passage of the Women's and Health Cancer Rights Act in 1998, the federal law has required health plans that offer breast cancer coverage to also provide coverage for breast reconstruction as well as prostheses. However, there does remain a large gap between the number of women who require mastectomy and those who are actually offered reconstructive surgery. Studies have shown that up to 7 out of 10 women do not fully understand or are fully informed about their breast reconstruction options prior to undergoing mastectomy. The goal of this bill is to increase awareness among patients about the availability of breast reconstruction provided under the Women's Health and Cancer Rights Act. While training in New York, one of my mentors was involved in the passage of a similar law in 2010. I am encouraged by the results of what it has done in New York and confident that similar changes can and will occur in Louisiana. The New York State Breast Cancer Provider Discussion Law has led to significant change in the reconstructive rate since its passage, with reconstruction rates in New York surging from 49% to over 60% in a matter of 6 years. Furthermore, when looking at the reconstruction rates before and after the law's passage, minorities and patients in lower socioeconomic backgrounds experienced the largest increase in breast reconstruction rates. And specifically, African Americans had a staggering 25% increase. At the end of the day, as a physician, it's quality of life that's important to us. Quality of life outcomes have been looked at by the major cancer institutions around the world. Novel surveys and algorithms have been developed, including the BreastQ in 2009 by Memorial Sloan Kettering Cancer Center. This has shown in multiple publications that quality of life post-mastectomy is improved with breast reconstruction. They found overall higher satisfaction, psychological well-being, physical function when comparing women who had reconstruction versus mastectomy alone. This leads to overall better patient outcomes, leads to empowering women with self-confidence and self-esteem, which in turn will continue to help them be productive members of our society. Currently, there are 28 states with mandates regarding education of breast reconstruction options. Louisiana is home to several of the giants in the breast reconstruction field that have propelled the specialty forward with advancements of techniques. We should continue to lead in this field and in women's health. Patient education goes hand in hand with physician education. Education of all parties leads to more collaboration and greater advances in techniques and technologies, and ultimately better outcomes for the patient. Every woman deserves the right to choose which, if any, reconstruction option is best for her. This legislation will help empower women to make the best care choices by ensuring that they are properly educated. The first step is passage of this bill. Thank you for your time.
Thank you very much for your testimony. We're going to take a slight commercial break, and then I know you have some other questions, but Senator Boudreaux, I think you wanted to welcome some folks here.
Yeah, I first of all want to just, this one hits home for me also, and just thank y'all for being here, and with Representative Stokes and everyone. And we're going to get back to it. With the chairman's permission, the room is overflowing and they can't stay longer. But I have some 21 students from a school in my district that are here and heard your testimony. I think that's what it's all about, this awareness, and that's what the bill is all about. And giving people an opportunity to voice. So, Mr. Chairman and members, we have 21 students from St. Paul, the Great Academy in Lafayette, that are here with us along the back wall, and the Sergeant at Arms have allowed them to stay. It's Miss Odenay's class from the Lafayette area. And while all of the students are in part, and there's one student who her parents vote in my district, Marie Draza, would you step forward? Hello. And for members of the committee, her father is Jeff Joza, who works with us on a lot of these issues. So I'm glad you all got a chance to hear this important thing and on awareness and options and just being informed. So this is part of the civics class, of course, but it gives them an opportunity one day to come and sit at the table and do exactly what we're hearing right now, and that's to bring awareness to such a very important issue. So if you would, members, help me welcome the students and Ms. O'Neill from our Lafayette School that are here with us today at the Capitol.
And just to add to it, Mr. Drozda's family is so big, you probably picked up 20 votes today. Representative Stokes, would you like to speak next?
I would, and I appreciate that. As most of you know, I'm a newly minted survivor, and I found out back in July that I, of course, had breast cancer and went through 5 not so fun months of chemotherapy. But it was curious because as I was going through that, and going through it with great doctors at my side, I realized that they were all talking to me about one solution. And I looked up things on the computer, and as I was looking things up, I found out that there was a plethora of interesting options, and mentioned to my doctor, about what I had seen about reconstructive. And then he said something about natural tissue reconstructive. And I didn't even say, I don't know what you're talking about. I just went online and Googled it and found out that there are amazing, just crazy detailed surgeries where they take tissue from your abdomen and reconstruct all the little arteries and veins and get them all connected and, reconstruct the breast. And it's an amazing surgery. It was hard. It was, for 6 weeks, I was not in the best of shape. And for 4 weeks, I didn't leave the house except to go to the doctor. But I will tell you that now I'm left better than I came into it in many ways. And thank you. And what I can say is that when you're in the throes of chemo, especially a lot of you guys saw me when I was going through the first 12 weeks, which didn't work. The first 12 weeks of chemo, the thing actually grew. It didn't work. And I was like, yeah, this is no big deal. Well, those last 8 weeks, nobody saw me because it was a big deal. And I'll tell you, the dehumanizing audaciousness of that chemo that you go through, that actually I was blessed that killed it, is such a deep, dark hole that if I had to think on top of that, I'm going to be left without all my humanity intact. That breaks my heart. It breaks my heart that somebody might not know about this, and this bill would correct that. And if we didn't already cover it, it would break my heart to think that only a woman of means could come out of this like this. And I'm just so thankful to the doctors. It's just been all at once a gut-wrenching, yet I feel fully restored. And I'll tell you, that's so important. So I really commend Senator Carter. And I want to make sure that I'm marked in there as a co-author because I'm not positive that I am. And just, I'm so honored to meet you and all of you guys. And thank you for your important work. So committee, I just ask that you pass this bill.
We sure will. And Senator Claytor has a question. You know, I guess I just say this for the audience. So many of us meet every Wednesday, and we fragmented on healthcare of this group wants to do this and this group can't do this. But this is one time I'm seeing the nods of everybody just proud that they're healthcare providers or they're involved in it. And you really have inspired us all. Thank you so much.
Before the question, Mr. Chairman, could I just say, I opened by saying how proud I am of my niece and for the heroic nature, the way she approached this. But I'd be remiss if I didn't also recognize this shero, this person that I am honored to serve with in the legislature, who demonstrated to us all a no quit, a can do, a make the best of the situation and come through shining. I could not be more proud of my colleague, our colleague and friend, Representative Julie Stokes. Give her a big round of applause.
Thank you so much.
Senator Claytor?
Thank you, Mr. Chairman. One of the things that I know you're all trying to accomplish and that Representative Stokes touched on, I just want to make sure that that I understand this right. Ms. Representative Stokes said I would hate for this only to be available to somebody of means, and so I'm worried, is there any false hope in this legislation as far as how it actually works on the actual coverage end of things? You understand?
I did. Several years ago, and I'm not exactly sure as to the date, but within the last 10 or 15 years, legislation was enacted that would cover reconstructive breast surgery. Because prior to that date...
On the national level? Or?
Well, there is national also.
98, yes.
Yeah.
In 1998, it was in the Women's Health and Cancer Rights Act of
Yeah.
1998. It made reconstructive surgery covered by both private and Medicaid, Medicare health insurances.
So
for
we,
all.
from here to there, we have everybody
Yes,
covered.
everyone is covered.
Because one of the words that I saw in there was the word availability, and sometimes that indicates whether it is or isn't available. So we're clearly saying it's available to everyone.
It's available to everyone. Availability in that section is referencing the technology or the ability, the skill set of a particular hospital.
All right.
or facility.
It just, I was perhaps reading it too technically and wanted to be sure on that. Also, I have an amendment that I'm going to offer, and that it falls under a section of the law that is currently entitled Oral and Written Summary of Breast Cancer Treatment Alternatives Law. And I'm adding, what language should I come up with? You'll probably figure out a way to improve on it, but where you were talking about access and information, when you're Googling and looking for these type of things, I wanted to make sure that the title of the section that it was in would be a little bit easier to find in case somebody's looking for it. So I'm adding to the current title, and access to breast reconstruction surgery information. You might want to change that along the way, but I didn't want that part not to be, make it easier to find, which is
Really-
what you want.
Greatly appreciate it. Thank you,
Thank
Senator.
you.
Why not right now, and we'll continue to hear testimony, but why not right now we'll clean up maybe the things that'll make the bill even stronger.
Okay.
Members, I think everyone was passed out Amendment 2860 that I'd like to offer up, that basically deletes general in the first line of line 7, and it basically talks about licensed by the Louisiana Department of Health pursuant to 40-2111, so 2100. So that'll make it where we catch all of the hospitals.
Good catch, Senator, and I certainly accept the amendment.
Okay, very good. So I'll offer that amendment. Is there anybody in opposition? Seeing no one opposition, 2860 has been adopted to 556. We have Senator Claytor's amendment, who he just talked about. Would you like to talk about it further, Senator?
I just did. It's on the.
Very good. So we have that, the 2865, we have a motion to adopt the amendment from Senator Claytor. And is there any opposition from the committee members? Seeing no opposition, that amendment is also adopted to Senate Bill 556. And ma'am, if you'd like to speak,
Thank you.
we want to learn as much as we can.
To the Senate committee, thank you for the opportunity to
Just
speak
state
here.
your name, please, if you don't mind.
Okay, my name is Jennifer Williams. I'm a registered nurse in the New Orleans area since 2011. Thank you guys for listening to us and allowing us to speak on behalf of so many courageous men and women who are faced with breast cancer. I've been working with breast cancer and breast reconstruction patients for most of my career. I have worked in the hospital setting and privately for a breast reconstruction surgeon. I'm involved with several cancer organizations, including the New Orleans American Cancer Society, and participate in several events throughout the year for breast cancer patients. I have recently begun working alongside Dr. Tandon and Dr. Gost, who are here today, and other doctors at Toro Infirmary in New Orleans. Here, they provide all breast cancer reconstructive options for patients. I have witnessed a functional and collaborative breast program in which patients are educated on their reconstruction options. Unfortunately, this isn't the type of system that is offered to many patients across our state. Through my work and my volunteer experience, I have unfortunately encountered countless women that were never educated on their options and their rights to reconstruction after breast cancer and mastectomy. These women were never informed of the federal rights granted to them for reconstruction after mastectomy, either immediately or delayed. Breast cancer patients are women of all socioeconomic backgrounds, geographic locations, and education levels. Although some of them are highly involved with breast cancer groups and organizations, many of them still haven't encountered people to educate them on their options. The diversity and lack of education women in our state have on existing laws and rights is unfortunate and needs to be improved. It is a woman's right to know about her options. Sadly, when patients aren't educated about them at the time of their diagnosis or mastectomy, they often won't find out about them. I know many of you are thinking in today's world of smartphones and internet, how can people not search their options? You know, not everybody has the insight like Ms. Stokes to do that for themselves. The reality is this is a very stressful and life-changing time for these women. Most patients haven't even had the time to grasp the words, "you have cancer," before they are faced with multiple appointments, decisions, and then a mastectomy. They find a doctor and a team and they trust them. They trust that they're going to be told what they need to know and get the treatment that they should get. So no, a lot of patients don't have the time to search their options for all of their treatments that they will receive. They are busy figuring out how their kids will get to school, will they have enough time off of work, and preparing to fight cancer. It should be the responsibility of their medical team to inform them of these options. Sadly, many patients are not given this right. Even in the year 2018, there is a large misconception that any reconstruction would be considered cosmetic, would not be covered by their insurance, or if they didn't get reconstruction at the time of their mastectomy, it was too late. This is unfathomable considering there have been so many advancements, legislation, and laws that have been made to ensure them of these rights. I have seen the hope reconstruction can give to a newly diagnosed patient. I've witnessed the joy that women feel when they know that they will wake up after a mastectomy without a piece of them missing. And I have seen that same transformation take place in patients with delayed reconstruction who learn years after their mastectomy of these rights. The woman that walks in missing her breast, a former breast reconstruction patient, will later walk out the same office doors whole, a survivor, confident, and with a special spark that they didn't have when I first met them. All women deserve this. Yes, reconstruction isn't for everyone. It's a choice that every patient and their medical team should decide upon, but every patient deserves the opportunity to make an informed decision. Through my involvement with breast cancer survivor events, I have informed several patients of their rights to breast reconstruction. There's often a roller coaster of emotions. First, the excitement that there is hope to feel whole again. Then they ask how recent were these laws passed to give them these rights. Their hope quickly turns to hurt when they found out that this has been a law for 20 years now. How could they not have known? How could their care team not have told them about it? I will never forget meeting a family at a breast cancer walk that consisted of a mother and her 2 daughters, all of which either had a lumpectomy or a mastectomy for breast cancer. They lived in different cities in Louisiana and had different treatment teams. Not one of them were educated on their rights for breast cancer reconstruction. All 3 of them began to cry and wanted to know more. I knew I had to do something to help prevent this from continuing to happen, and I hope we can help start that process today. Again, we thank you all for your time and consideration of this information and of the breast cancer patients that we are lucky enough to help fight for today.
Thank you all very much. I can say between the audience and the committee, we've all learned something in the last few minutes. This is probably the first time we've ever done this. We have an amendment that's offered up by the entire committee, and we're all doing this from a unanimous standpoint. We'd like to amend the bill to basically say this part shall be known and may be cited as the Carter-Stokes bill. It'll be this Carter-Stokes and access to breast reconstruction surgery information. So right now that this bill will be named after you and both of you. So I think we have a unanimous second to adopt it, huh? Yeah.
Thank you.
Thank you all so much. Senator Erdy?
Thank you, Mr. Chairman. What a powerful testimony. I thank you for that.
Thank you.
I know it comes from the heart, and that's the best way to come to the table and inform the people. The one thing that I took from this particular legislation is the fact that insurance is available, and I think that's, in my opinion, the thing that sits back in people's mind is that, oh my God, I got to go through this procedure. How much is it going to cost me? So from that perspective, I think that's a huge part of this legislation, is to let the people know that, hey, insurance is going to be part of solving this problem and not something that they got to deal with. So, and I thank you for bringing this forward. Senator Carter, thank you. And ladies, y'all did a fine job. Appreciate your testimony. And Julie, I can't say enough for how much you have meant to all of us in terms of where you've come from and where you're going. And I think the Lord is a part of that process, and we appreciate that.
Thank you.
Absolutely, and thank you.
Usually we have to give the people that testify Kleenex. We're going to need Kleenex if we keep on. On that note, Senator Carter, would you like to close? Would you like to say anything in
Yeah,
closing?
just briefly. I want to recognize some people. I know my mother she may be here. She's on her way trying to be here to witness her granddaughter do what we fully expected she would do, that is to articulate a very sensitive issue with style and grace, and she certainly has performed. I'm not sure if my mother's here, but Reverend Eartha Carter, she may be in the audience. If not, give her a round of applause. Mom, if you're here, stand up. My older brother, Gary Carter, who is the father of Representative Gary Carter and the father of this outstanding lady. Gary Carter Sr., if you're here, Gary, stand and be recognized. I'm not sure if they made it. Might have been caught in some traffic. But we are fortunate for certain to have her husband, Russell Frank. Russell, could you stand up and be recognized? Along with her mother-in-law, Jocelyn, is here.
Nice to have. Nice to have.
And last but not least, one of her two sons, Jacob, is here. Jacob, you stand up. So as you can see, this is very much a family affair.
That's awesome.
Jacob, I'm getting sleepy like you.
And that's rare because he usually be running around this place pretty good. So
They got a donut truck right down the road. Yo, go get him.
that's what he needs, some sugar.
Exactly.
So with that, I think all the testimony that has taken place speaks for itself. Again, I cannot emphasize the amount of pride that I have today for these two outstanding women and all of the other advocates that have come forward. But equally, or nearly equally as proud, is the pride I have to be a member of this body and to hear the wonderful comments and work with such outstanding people as you all are. God bless you. And I urge favorable passage, sir.
On that note, Senator Boudreaux, I know you and your family have walked in these shoes, so the motion will be by you. And we have a motion to report with amendments. Oh, I think we did adopt it, but I'll just, the last set of amendments, the Carter, okay.
Withdraw the one that I originally did.
Okay, we'll withdraw, we'll reconsider that vote, so we'll withdraw that amendment, and we will have the revised amendment that has all of the language in it and the naming of the bill. Is there any, that motion has been made by myself, is there any opposition? Seeing no opposition. Okay. 2867, thank you, Senator Early. So we do have a motion from Senator Boudreau, and that motion is to report 556 as amended. Any opposition? Seeing no opposition, that is reported. And we would note that we'd like to pass a co-author sheet out, and also note that Representative Stokes, since the bill's named after her, would need to be a co-author. So thank you. Thank you all very much. Thank you all so much.
Mr. Chairman and members, thank you all very, very much. Greatly appreciate it.
Y'all enjoy the rest of
Thank
your day.
you.
Thank you. Thank you. Representative Davis, or is Labar here? Representative Davis, are you ready?
If the bar was here, we can't be sure.
Yeah. Thank you. Representative Davis, it's sort of on the theme that Representative Leger had. So welcome to Senate Health and Welfare.
You'll do better off without it. There.